Hi, good morning. My name is Kiki. I'm 35 years old and I have breast cancer. Um, I was officially diagnosed in October of 2019 when I was 34 years old. It is something called invasive ductal carcinoma, which basically means that the cancer, it was caught early, but it had spread out some. Um, and I'm doing this sort of journey documentary just to kind of give an insight of my journey and the things that I've gone through and experienced. It's definitely been eye-opening and rough and filled with emotions and things I guess I never thought I would experience in life. Um, and what I want people to get from this is that you really, really have to listen to your body and be in tune with, what your body is telling you. So if I jump back a little bit, I found out in October officially that I had the breast cancer. But I actually felt the lump way back in like maybe May of 2019. And I know that sounds like kind of crazy to kind of wait for so long, but let me tell you why. So, because I have really small, dense breasts, sometimes during that time of the month, um, I would normally get cysts or, like little knots, underneath my armpit or, in my breast. And that was pretty much normal for me ever since I was about 12 or 13. So when I initially felt the knot, I didn't really think too much of it. It was very, very small. And it actually didn't bother me too much. My breasts just felt kind of tender as they would normally do during that time. So, I really didn't pay much attention to it. Skip a few months, the knot never went away and it just kind of kept growing and getting bigger and bigger to a point where it was really bothering me. I mean, even just to put a shirt on was really, really painful and uncomfortable. So my husband kind of, forced me to go to the doctor, which I did. And, from there, they sent me to get a mammogram. And I got something called a 3D mammogram because, like I said, my breasts are very small and dense. So it kind of captures the image a little bit better, if they see anything. And they did. And I actually found out that same day, mind you, I was by myself, that they were about 95% sure that it was some form of cancer. And I literally stood there in University of Radiology, just kind of, I was really taken. I didn't know what to think. I was by myself. I didn't want to jump the gun because I know that they are doctors, but they are not always correct and they are not always right. And after that point, I had to wait to get a biopsy, which took a little over a month for me to get. It has to be scheduled. Only certain offices offer, the breast biopsy. And once I got that done, I can't say that I felt relief. I had all these questions and I was so nervous about what they were going to call and tell me. And I had every right to be. They actually called me October 1st, which everyone knows is Breast Cancer Awareness Month. So how ironic is that? And told me that the test came back, and I definitely did have a form of cancer called invasive ductal carcinoma. And I literally fell apart. And I didn't tell many family members, I didn't tell anyone at work. I didn't tell many of my friends, because it was just something that I kind of I needed to process, and a part of me is still processing it, even though the situation is almost over and done with, so to speak. It was really, really hard to hear the diagnosis over the phone, like a confirmed diagnosis, I should say. And what I want young women, to kind of be aware of your body and what your body is telling you. Either way, it would have been, I was diagnosed with the cancer, but I feel like maybe if I had gone to the doctors earlier, I could have saved myself a little bit of the heartache and pain. That's probably really not true, but it's kind of how I feel. And it's been a long journey. So I unfortunately do have a mutated gene, and hopefully I did not pass that on to my daughter. So it's not just myself that I worry about. Even when everything is said and done with me, I now kind of have to worry about her. And so with that diagnosis, I decided to get something called a double mastectomy or bilateral mastectomy, which is basically they, take both breasts. And I did that because, number one, having the mutated gene, if, you take, let's say, the bad breast, it could potentially come back into the other breast. And I kind of just did not want to have to think about that. I didn't want to go through that again. So to me, anyone that really knows me knows I never really had breasts to begin with. So it really wasn't a hard decision. They kept asking me, am I sure? And, my answer never changed. This is what I wanted to do. And I had that done November 11th, 2019. We are now, what's today? Today is February 29th. So as of now, I don't have any breasts. What I do have is something called expanders. So basically with expanders is once they, took both breasts, they put almost like, I call it a balloon, underneath the skin, and each week they would fill it with solution so that when I do have my reconstructive surgery for my implants, the skin is already stretched out to, about the size that I want to be. It's not really painful, but it's a little uncomfortable, having something foreign in your body. And because of that, I've been hospitalized 3 times due to infections and fluid buildup. Yeah, it's rough, but I just kind of try to get through the days. And I've been doing chemotherapy for 12 weeks. Next week, God willing, will be my last chemotherapy treatment. From there, I will have my breast implant surgery, and I will have to be on a hormone therapy pill for minimum 5 years. And that's just to keep the cancer cells from growing, and hopefully it never comes back anywhere else. And that's the thing with having a mutated gene, that even though it won't come back as breast cancer because I don't have any breast tissue or anything. It can always come back as something else, cervical cancer, myeloma, you know, cancer of, your liver. I just really try not to think about that and just focus on my treatment right now. And I think that's really kept me going. My family, my friends, so much support. And that's one thing you really do need is a lot of support. My next video, I'll be talking about, your support system and, things that I had to kind of like adjust to. And, it's all a journey and full of ups and downs. It's been really hard. You can see, bald now. And that's okay. I'll be talking about the symptoms that I experience. And please keep in mind that everyone's experience will be different with cancer. And that, there are so many different forms of breast cancer. It's not just one form. So, like my sister has a totally different form of breast cancer. So, it's been very knowledgeable as well. So, just, I'll keep you posted. And anyone ever has any questions or just want to talk, or, you're going through, something similar and you kind of don't know where to start, you can always contact me. And like I said, my journey will be different from your journey, but, this is a fight that, we have to fight together. I don't ever want anyone to feel like they're fighting alone. I know that feeling, and it's really not a good feeling, to feel like you're alone when you're going through something so traumatic. So until next time.